Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde, et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and Honorable Blaine Higgs, Premier of New Brunswick. Les personnes suivantes prendront la parole de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef, et l'Honorable Blaine Higgs, Premier ministre de Nouveau-Brunswick. Dr. Russell.
Good afternoon, bon après-midi. Excuse
I just want to say sorry why we're late. It happened that we're perhaps late, perhaps too often, but today, when we started to plan today's information session on the COVID-19 pandemic, I had told you that the day would come where we would have sad news to announce. And we knew that it was just a matter of time before a first death attributable to COVID-19 happens in New Brunswick. I'm sad to say that that day has come. Yesterday, a person aged 80 to 89 9 years old who had underlying health problems died at the Campbellton Hospital following COVID-19. And this is one of the cases linked to the outbreak that can be found at this time in Campbellton, Restigouche. He was living at the Manoir de la Vallée in Atholville. I offer my most sincere condolences to the family and loved ones of this individual as they grieve in this difficult time. And I know that it's truly a very sad day. And our thoughts are with the family and loved ones of the person who died, and also with all the people in the Campbellton and Restigouche areas today.
on the COVID-19 pandemic, I cautioned that a day would come when we would have sad news to share with you. And we knew it was only a matter of time before New Brunswick would suffer its first loss of life. And I'm saddened to inform you that that unfortunate day has arrived. Yesterday, an individual aged between 80 and 89 with underlying health conditions passed away at the Campbellton Regional Hospital as a result of COVID-19. This individual is one of the cases connected to the ongoing outbreak in Zone 5, which is the Campbellton-Restigouche region, and had been a resident of the Manoir de la Vallée in Atholville prior to being admitted to the hospital. My heartfelt condolences go out to the family and loved ones of this individual as they grieve in this difficult time. And really, my thoughts are with the entire region of Campbellton, Restigouche right now, as they are feeling the stressful effects right now of COVID-19 in a very unfortunate way. So in keeping with our practice of protecting people's privacy, the Department of Health will not be providing any additional details on the particular circumstances surrounding this individual's death. And I want to thank the medical professionals and frontline workers for the care and compassion they have shown for this specific case and all the cases associated with the ongoing outbreak in Zone 5. This is obviously a very stressful time for frontline workers, and so we need to make sure that we are doing as much as we can to support them at this time. So as a province, I think this is a very sad day for all of New Brunswickers. It has been difficult to witness the unfolding outbreak in the Campbellton-Restigouche region, which has gripped that community with stress and worry and now grief. But I think the ripple effects are really being felt around the entire province at this moment in time. I think there is an apprehension that this could happen elsewhere, and it is true, it could happen elsewhere. And so for that very reason, we need to wrap our arms around that community and support them as we would want to be supported if and when a COVID outbreak happens in our community. It has been particularly hard for the staff, the residents, and the families of the Manoir de la Vallée, where half of the cases in the outbreak have occurred. That outbreak continues, and I ask that everyone keep the people of Zone 5 in their thoughts and prayers. Today, there is one new case to report in New Brunswick, and it is in Zone 5. It is an individual aged 20 to 29 who is a healthcare worker employed at the Manoir de la Vallée in Atholville. Aujourd'hui, j'annonce qu'il y a un autre cas de COVID-19 à confirmer.
I have another case to confirm in zone 5. It is a person, individual, aged 20 to 29, who was a healthcare worker employed at the Manoir de la Vallée in Atholville.
At the Manoir receive the best care possible. So, extramural, Ambulance New Brunswick, Vitalité, Public Health are all working together along with social development to make sure that all the needs of the residents are met at this time. So we are grieving today, but we're also moving forward. We can't stand still in our province, and I said the other day, if everybody could just freeze in one place, we could try to stop COVID-19 from continuing to affect us, but we can't do that because of this pandemic that is in our country and around the world. We have to adjust our daily lives and regular routines to meet the challenge of life during this global pandemic. And I think people are tired of hearing the words, this is the new normal. But as we adapt and change and adjust to this reality, I think we have to acknowledge the challenges that we face when doing so, but it is the reality of how we need to be living now. We do have to learn to live with COVID-19, and that is what we are doing. It was never our expectation to have 0 cases or 0 deaths. Early on, we gave projections of worst-case scenarios, medium-case scenarios, and best-case scenarios. But even the best-case scenario did not have 0 cases, and the best-case scenario did not have 0 deaths. The best-case scenario and our objective has always been to minimize the impact of this disease on our province while protecting the healthcare system, while protecting the least vulnerable in our population, those least able to protect themselves. And these would have been pre-existing populations of vulnerable populations even prior to the COVID-19 pandemic. And those challenges of those vulnerable populations are even highlighted and amplified during a pandemic. The overall health of New Brunswickers requires that we move forward with due care and attention while maintaining our caution against the disease. We have seen unintended consequences. We've seen collateral damage for people's mental health, for people's income, for people who have not been able to access treatment and surgeries in a timely way due to the postponing of these things because of COVID-19. Au cours de la dernière semaine, nous avons
Over the past week, we've seen many great scenes in New Brunswick where businesses were opening and client and families were able to get together without seeing themselves in person. But still, there are still some who can't see their dear ones in the special care homes, so we still have to show compassion. As well, the majority of New Brunswick will be transitioning to the next phase of the yellow phase, so that some restrictions will be loosened, and as part of the emergency state of emergency, and the Premier will be giving details in a few minutes.
Phase until the outbreak in that region is under control. We are not there yet, and I must ask that the residents of Zone 5 continue to be patient and follow public health directions so that we can limit the spread of the disease in that region. And I did mention earlier that it's best to avoid unnecessary travel into and out of that region right now. And we do have more than 300 people who are self-isolating at home and who are patiently or impatiently looking at the calendar every day, checking off the 14 days until their self-isolation is done and they're out of the woods in terms of worrying about developing symptoms for COVID-19 and testing positive. So the people of Campbellton Restigouche area are bearing the brunt of this current outbreak, and they need the support of all New Brunswickers. I hope that everyone will take the opportunity to reach out to family and friends in that area and show them that New Brunswick stands with them. In the months ahead, there is every chance that other regions of New Brunswick will experience what Campbellton Restigouche region is going through today. And really at any time, since the fact that our borders are open, COVID-19 can travel in with any one of the people coming across the border every day. And I don't want people to be ostracizing or villainizing or stigmatizing people from that area right now. I know there have been fears about, oh, I saw that person from Camilton, I know they're from Camilton, and I'm worried. Well, the people that are most concerning for public health right now are at home, in their houses, not posing a risk to anyone right now. But we are in a pandemic, so everybody needs to be symptom watching at this moment in time, and that will continue throughout the pandemic, regardless of whether there's an outbreak in this province or not. Outbreaks are part of our reality now, until a vaccine or other treatment for COVID-19 becomes widely available. Other regions may see a swift spreading of cases and the reimposition of restrictions on their lives. We do not wish that to happen, and we're going to do everything we can to avoid that from happening, again, until a vaccine is found. We will respond quickly to limit the spread of this disease whenever and wherever it emerges. And I think we just need the population to be ready to work with us every time we see a situation like this. So when it happens elsewhere in New Brunswick, I know the people of Camilton and Restigouche will be there for us, just like we have been there for them. We have called on healthcare workers to come from around the province, just like firemen rushing into a fire. There are people going there to help. And they may be scared, but they're very courageous, and I want to acknowledge the work that is being done to make sure that the Camilton Hospital is being staffed properly and the Manoir de Vallée is being staffed properly. These are very courageous people who are going into a situation that they know has risks, and they are willing to take those risks, and I commend them, and they also need our support. For those living in Zone 5, I must ask you to continue to limit your close contacts in your 2-household bubble. Please avoid close contact with anyone outside your bubble. The restrictions on personal service businesses such as hairstylists, manicurists, and tattoo artists remain in place for the time being. All of New Brunswick shares the grief now felt by the people of the Camilton-Restigouche region. Toute la population.
All the people of New Brunswick are sharing in the mourning that the people in Camilton-Restigouche are going through. This situation should also remind the people of New Brunswick that COVID-19 is among us and will stay for us for some time yet. During this pandemic, this outbreak reminds us the concrete threat that the virus represents for our health and our life. Don't take any risks with this virus. Be careful. Watch for symptoms. And the people who want to have appointments with people, take precautions.
This poses on our health and our lives. Please don't take chances with the virus. Stay very cautious and watch for symptoms. Again, everybody will need to continuously watch for symptoms for this entire duration of the pandemic. Continue to practice physical distancing whenever you can. When you can't, wear a community face mask that covers your mouth and nose. Remember that we are on a journey together. There are rough seas all around us, and some of us will feel the effects of that more so than others. And I did see this on Facebook the other day, that we may not all be in the same boat, but we are all in the same storm. And we can come through this storm together. Thank you very much. Merci.
Good afternoon. Bonjour. Like all New Brunswickers, I received the news of our first death to COVID-19 with a heavy heart. Though we always knew this day would come, we were always hoping for the best that it wouldn't. Sadly today, we also learned of a non-COVID related death of a woman in the Edmundston. On behalf of the people of New Brunswick, my wife Marcia and I extend our deepest sympathies to the family and friends of both of the individuals, as well as all of those in the region. Our thoughts and prayers are with you. This has been a difficult time for everyone in our province. I want to thank New Brunswickers for their patience and their continued willingness to put the health and safety of everyone in the province first in their efforts to limit the spread of COVID-19. Last week, we made the tough decision to put off the loosening of further restrictions across the province due to an outbreak in Zone 5, the Camilton region. At that time, Zone 5 also returned to the orange phase to ensure we could get any possible spread of the virus under control. It is important to realize this may not be the only time a zone reverts back a level while we work to determine the extent of an outbreak. Comme nous l'avons
As we saw over the past week, the virus is among us, and we are still vulnerable. No matter what precautions we take, the best we can do is reduce the risk for our people.
In this case, delaying our next step forward by a week gave us the time we needed to determine how widespread the outbreak was and to take the steps needed to protect the health and safety of the people of this province. Thanks to the dedicated efforts of public health and the support of New Brunswickers, especially those who live and work in Zone 5, we were able to do the necessary contact tracing and testing in that region. In fact, we did over 4,000 tests in less than 72 hours.
Thanks to the participation of all people involved, we have been able to, so far, limit the spread of the virus to Zone 5. And thanks to contact tracing, we've been able to determine the spread of the. And since we are continuing to have more active cases in the Campbellton area, this region will continue to be in the orange phase for now.
However, Cabinet and the All-Party Committee on COVID-19 has decided that the rest of the province is ready to move into the next phase of the yellow level. This means that effective tomorrow, outdoor gatherings of 50 people or fewer will be allowed with physical distancing. Indoor religious services of 50 people or fewer will also be permitted, as long as physical distancing is respected. The limit on gatherings will be reviewed on a regular basis and could change depending on risk levels in the province. Regional health authorities will increase the number of elective surgeries they perform, and the number of non-emergency services will also increase. Low-contact sports activities will also be able to operate as per the guidance provided to them by their national or provincial organizations, as long as they identify ways to limit the number and intensity of close contact during play. Toutes les ligues de sport.
All sports leagues, provincial, regional, and local leagues, will have to prepare an operation plan. The youth leagues will have to make sure that the number of spectators who watch games is limited to one adult per child. Reasonable efforts will have to be made to respect as much as possible physical distancing during sports events.
A number of other services will be allowed to open on June 5th, as long as sanitization requirements are met and physical distancing measures are in place. These include swimming pools, saunas, and water parks, limit of 50 per facility or area, gyms, yoga studios, and dance studios, rinks, and indoor recreational facilities with a limit of 50 per area and for spectators, and pool halls and bowling alleys. When this began, we took the steps necessary to protect our most vulnerable residents, including those living in nursing homes, special care homes, and adult residential facilities. We recognize this has been hard on family and friends who have not been able to visit their loved ones. As part of the further loosening of restrictions in the yellow phase, we will allow outdoor visits of up to 2 visitors at a time. We recognize that not every facility will be able to do this, but we want to be able to give them the option to do so if they can. For the visits to take place, there must be sufficient outdoor space to allow physical distancing of 2 meters or 6 feet from the resident, and this distance must be maintained throughout the visit. If this goes well, on June 19th, controlled indoor visitations in hospitals, nursing homes, special care homes, and adult residential facilities will begin. 1 visitor will be allowed at a time unless the visitor requires support, in which case 2 visitors will be allowed. The
name of the visitor must be provided to the establishment in advance.
Community face masks during their visit and must adhere to other policies and practices the facility has in place. Facilities will be required to develop a plan to manage visitations prior to the visitation's actual beginning. As well, overnight camps will be allowed to open on Friday, June 19th, as planned. Comme nous l'avons déjà mentionné,
As we already mentioned, the summer camps will have to put in place public health measures such as physical distancing, intensive cleaning and screening for children, parents, and staff. Summer camps will also have to have an operational plan before they open.
Canadian residents that own property in New Brunswick will be allowed into the province as of June 19th if they self-isolate for 14 days upon arrival. As well, Canadian residents that have immediate family in New Brunswick, including a parent, child, sibling, grandchild, grandparent, or significant other, can come to the province as of June 19th if they self-isolate for 14 days upon arrival. Cabinet and the All-Party Committee has also decided that for any resident of Canada, travel into New Brunswick to attend the funeral service or burial of an immediate family member is necessary travel, if conducted in accordance with guidelines of the Chief Medical Officer of Health. The guidelines and more information about this will be available next week. As noted before, this loosening of restrictions does not apply to Zone 5, the Restigouche region, at this time. Tant que nous ne pouvons
As long as we cannot be sure that the current outbreak has been contained, Zone 5 will have to stay in the orange phase, which authorizes the opening of many activities and businesses. We will continue to follow the situation, but we must not rush things.
the health and safety of all New Brunswickers is at stake. I understand that it is frustrating to those who live and work in the Restigouche region, but taking the proper precautions in the short term will have positive long-term impacts in our province. Working together, we will get through this challenging time. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci, Dr. Russell. Merci, Monsieur le Premier ministre. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question. We will now proceed with questions from the media. Each reporter will have one question, and you have the right to pose your question in the language of your choice. Callum Smith, Global News.
Thanks, Bruce. Dr. Russell, I guess we've heard bits and pieces of this so far, but what else is being done at the Manoir to prevent the loss of life for any other New Brunswicker?
So as of right now, all the patients or residents rather, are isolated. Somebody asked me the question the other day if they are able to be isolated individually, and the answer is yes. And the patients who tested positive are all in the same wing. So that's called cohorting. So those people are cohorting in one being cohorted in one area. There is ongoing testing of staff currently, so that anybody who is working with COVID positive patients and otherwise do have the ability to get tested and are tested every couple of days at this moment in time. And in terms of staffing needs, again, the extramural, Ambulance New Brunswick, social development, public health, and Vitalité, and probably Horizon as well, are working to make sure that we have the right amount of workers to assist in the situation at this moment in time, because the people up there who are doing the work currently are working very, very hard, and so we have to make sure that we continue to make sure they have the right support at this time.
Thank you, Doctor. Thank you, Mr. Smith. Michel Corriveau, Radio-Canada.
Bonjour, c'est une...
Hello, this is a question for Dr. Russell. I would like to know if the person who had been confirmed at the manoir. Do you know if that person was already being in lockdown and was perhaps the first one to be isolating? Well, all staff of the Manoir de la Vallée were tested at the beginning of the outbreak, and those that had tested positive were staying isolated at the house, and those who didn't have symptoms and those who didn't have the virus continued to work but were tested every 2 days. And that is the situation at this time. And this is information we're following each and every day. Merci, Mr. Corriveau.
Thank you. It's a question for Dr. Russell. What is the condition of the rest of the people in hospital now, and how many are they? And how are you are you expecting more deaths within that group?
The last I heard, there are 4 who remain in hospital, and my understanding is that they're stable. And but again, that could change at any time. I think it's very hard to predict, so I don't really like to say that I have a crystal ball to say what's going to happen. So 3 are stable, and there is 1 person in ICU.
Thank you, Ms. Ibrahim. Adam Harris, Telegraph-Journal.
Thanks, Bruce. For the Premier, I just want you to elaborate on immediate family members being allowed into the province and if they can self-isolate for 14 days. And then also how you reconcile that on such a hard day for the province with a first death.
Well, I think it's a combination of sadness and hope. We at all points in time through this, both Dr. Russell and myself were always cautiously optimistic, but realistic in the fact that our first death would occur through this virus. So unfortunately, that day did come, not unexpected, but certainly like hoping it wouldn't. But in the same vein, we have to look at those that are being challenged in many other ways, and it's family, it's getting back to a new norm with COVID, and getting on with life in our province and that recovery. We've seen a lot of anxiousness, a lot of emotion, a lot of pent-up emotion that's related to the restrictions that we've had to put on our province. So, being cautiously optimistic that we will move forward as a province and recover in a meaningful way. I think that the situation in Campbellton, although extremely unfortunate, has demonstrated a capability that both public health and our health professionals throughout our province has been able to move into an area quickly. When I mentioned 4,000 tests in 72 hours, we hadn't done anything close to that before. But we always said if the need arose, Dr. Russell had said many times that we want to be able to move in, do rapid testing, and understand and contain the spread. At this point, certainly the understanding is, yes, we do know where it is. It is contained, and we need to move on with the rest of the province. And hopefully, we will be able to move on in this region in the coming weeks.
Thank you, Mr. Harris. Isabelle Larose.
Oui, bonjour.
Yes, my question is to the Premier, Mr. Higgs. The Public Safety Minister said he'd be favorable to letting Quebec tourists to reach the Magdalen Islands, and they would have to be crossing at the Prince Edward Island. Is it confirmed that the government could go ahead with allowing the passage of tourists toward the Magdalen Islands?
We said at the beginning we would work with PEI and come up with a kind of a joint proposal. And I know Premier King had been talking with officials in Quebec about the prospects of how this would work. So we'll continue to do that. We haven't restricted people from moving through our province out to other provinces. That's been from the beginning. We just want to be able to understand the traffic, and we want to minimize the risk, but we want to not restrict other provinces from where they are in this pandemic and what they believe is possible for them to achieve. So if Premier King is, and we'll continue to have the same protocols in place, and he's on the same page, then for residents of Quebec to move through our province, through PEI, to their resident on the Magdalen Islands, we would certainly find a way to accommodate that.
Thank you, Premier. Merci, Madame la Rose. Laura Brown, CTV.
Hi there. I'm wondering, I was speaking to an MLA from the Campbellton area yesterday. He had said that he was told that testing in other nursing homes and long-term care facilities should have already started. I'm wondering, because of the workers and some of them having to work in two different facilities, if testing in other nursing homes and long-term care facilities has begun.
Hi, Laura. So two things. One, originally we were going to test everybody in all the long-term care facilities in that zone. But as we got results back and we looked at all the data, the highest risk obviously is for staff, who work in those particular nursing homes, et cetera, to bring COVID-19 into them. So we're testing the staff of all of those nursing homes at this moment in time in Zone 5. And at this moment in time, staff are not allowed to work in more than one nursing home at this time.
Thank you, Ms. Brown. Mathieu Wacomo, l'Acadie Nouvelle.
Hello, my question is for the Premier Higgs. Earlier, with the outbreak in Zone 5, I think you said that it might be possible to have a bubble with the possibility of having a bubble with PEI is stalled. But now that the outbreak seems to be rather contained in Zone 5, whether there's a possibility of having a tourism bubble with PEI, whether that might be brought back to the table before the end of summer.
Yes, I think that certainly is possible, and we will continue to have discussions with my colleagues here in Atlantic Canada, and certainly in this scenario with PEI, we'll work. Certainly, Dr. Russell and her team will work with PEI and looking at this for potentially early summer is a reality. The next couple weeks will be telling, however, because we are watching closely what unfolds for us here in the province over the next 14 days.
Merci, Monsieur Boiscomont. Thank you, Premier. Kevin Bissett, Canadian Press.
This is also for the Premier. Premier already should expand on that last answer and your discussions with the other premiers in the region as well, and talking to Nova Scotia and Newfoundland as far as a regional bubble.
Yeah, well, we have had those discussions, back a few weeks ago, and then of course we've had this little setback or significant setback, but it is localized, so that makes it manageable at this point. But all provinces, I'm talking about our Atlantic provinces, we're in different phases, and we have to recognize that as we move forward. But having those discussions going forward and throughout the summer. So we once again can get back to a reasonable normalcy will be our goal. But I would say the first likelihood of something there would be with PEI.
Thank you, Mr. Bissett. Thank you, Premier. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, I spoke with a federal border agent who said that the Quarantine Act is still in effect at the international border, which means only essential travel is permitted, which also means that Campobello Island residents still can't travel to the mainland to see family or take staycations and vice versa. The yellow phase of recovery doesn't seem to apply to them unless there's a ferry in the water, which has also resulted in businesses staying closed, as well as a 6-year-old girl who left the island with her aunt to visit family on the mainland being ordered to quarantine for 14 days, and she's still separated from her parents who don't know how to get her home. The June 29th date for a seasonal ferry still feels like it's weeks away, and businesses and citizens are suffering. Is there anything that can be done now?
Well, I guess I would like to understand more about those specific cases, because it would be my understanding that we have worked out an arrangement with the state of Maine that people have been able to travel directly through Maine to get to New Brunswick, and haven't been restricted by the particular quarantine rules that would apply generally. We worked through that process early on, so I would like to maybe know more about these cases and understand what are the nuances here. Is there something that I'm not quite understanding? Because I was quite pleased with the response that I had from the federal government, working with Deputy Prime Minister Freeland and with the state of Maine, in how we could make that work effectively for residents that were stranded on an island.
Thank you, Premier. Thank you, Ms. Hogarth. Andrew Watt, Telegraph Journal.
Yeah, hi. Not really sure who my question is for, but my question is more of about, now that we're talking about the virus as a reality, it's going to be here for, the foreseeable future. The borders aren't closed. Can somebody just talk to me about what you expect to happen in terms of COVID over the next few months? I mean, you've both spoken about a lot of nervousness and apprehension across the province. What is your sense of where things are now and where things are going?
Well, I can start, Andrew, and the Premier can add comments if I miss some points. So from the beginning of the pandemic globally, we had planning sessions. We had a lot of information sharing across jurisdictions from a public health perspective. And then when the government got organized with respect to the pandemic task force as well as the COVID-19 cabinet, we were able to set up a structure whereby we could have the information transmitted amongst all our partners on a regular basis with our emergency operations team, flowing with information in and out of all the different partners in terms of what needed to be operationalized. And so from a health perspective, we have our health response, but an all-of-government approach was also being undertaken concurrently to look at all of the different elements, not just from the health service delivery piece and not just from a public health piece, but making sure that we're aligned with all the different organizations in terms of our approach. And that was really one of the key components of the pandemic task force, to align both RHAs with respect to operationalizing information, EMP, A&B, the nursing homes, special care homes, ARFs, adult residential facilities. And the advantage of the emergency operations team at Health was they had representatives from all different areas of government. So there were working groups every single day meeting around testing, meeting around laboratory medicine, meeting around contact tracing, meeting around whatever issues, vulnerable populations, working out plans for all of those things in a very stepwise approach. So where we are now is we've come through, our first wave with respect to the travel-related cases originally, and then imposing all of the measures. So the Emergency Measures Act, as it was imposed in our red phase, we worked through that. We saw what would happen when we were able to contain the virus at that time, taking into account all of the, as I mentioned before, the unintended consequences, the negative impacts, the collateral damage of all the pieces of society, the economy, and health services that were interrupted at that time. So with all of that knowledge now, moving forward into the next part of our reality, as we've talked about, is that, yes, we have a 30, 60, 90-day approach to what's happening right now and in the immediate future and the near future. And so the next planning phases are really about looking how to transform ourselves while we exist with COVID-19, and that transformation and growth and innovation is happening now in terms of where we need to go next and how best to exist and survive and thrive with COVID-19 in this province and prepare for the second wave. So we are looking at all the different pieces of information that we have learned from through all of the experiences thus far, and we will continue to be learning. This is an evolving situation, and even though we might prepare and try to, we did many tabletop exercises, we've looked at worst case scenarios, best case scenarios, and everything in between. We've done tabletop exercises, we've done mock exercises, we've gone in and done these rapid testing situations, and so there is a vast amount of knowledge now that we've able to consolidate to formulate a way to continue to move forward. So that's where we are, and I think to be cautiously optimistic as we continue to work together. Again, I've seen enormous amounts of blood, sweat, and tears going into the work to navigate through COVID-19 at this point in time. And I know the citizens of New Brunswick have probably felt it and lived it themselves. And at this point, I will ask Premier Higgs if he has anything to add. But so far, again, I'm proud of all the work that we've done as a province. We have a lot more ahead of us, but I think with what we've been living through and experiencing thus far and the learnings that we're taking away, we do have some opportunities to continue to move forward. Premier Higgs.
Thank you, Dr. Russell. I think what I would just add to that is related to the economic recovery. And we've seen over the last 2 to 3 weeks, according to CFIB, basically the Foundation for Independent Business, we've seen an increase in businesses that are open to go from like 25% to about 58%. In the last week alone, it's climbed from like 54 to 58, and it's climbing. We're seeing businesses basically say, you know, just let us understand the rules and let's get up and get going. I've been very focused with my colleagues across the country and with the discussions we've had about what does New Brunswick look like on a new economy around living with COVID-19 and beyond. So many of the lessons that we've learned through this pandemic in the last 3 months are being put forward as ideas to help us be a new model for government going forward. The activities that we're trying to promote here would see a long-term sustainable view on New Brunswick growing in a way like it never has before. I think we've demonstrated some firsts in the province that are being recognized across the country, and I think we're moving in a way that's generating some hope despite the setback news today. So I'm telling businesses, you know, to find a way to work with this new reality, to look at what's going to be like a year from now or 5 years from now. And my focus is very much not just, you know, it's managing today, but it's building for tomorrow. And in New Brunswick, you know, unfortunately, our province is pretty well taxed out in relation to the level of taxes on personnel and businesses here. So the focus is how do we just get better? And how do we have a future that when we make a decision, it's not just about today, it's about tomorrow, and it's about next year, and it's about the generations to come.
Thank you, Premier. Thank you, Mr. Waugh. Jean-François Boisvert, L'Acadie Nouvelle.
Oui, bonjour.
Yes, today. Hello. My question is to whoever would want to answer, Mr. Higgs or Mrs. Russell. Despite this first death in the province, we can be relieved that the number of cases has not gone up in a drastic way. And it seems to be confined to one region. So things are doing is it possible that we might be able to have an end to lockdown quickly, or are we still going to have to stay at point zero to start with? Well, at this time, the plan is to wait at least 14 days before, in order to have as much information as possible to decide whether we can advance, whether it's to go toward the yellow phase or whatever, because it's 14 days after the outbreak. It's only at that point where we can know whether the self-isolated cases might become positive. We at least want to wait 14 days to see how many cases will still be active. Some say we should wait even longer. But as the information comes to us to make decisions, we have to wait at least 2 weeks for something like that. And certainly, even if this outbreak is contained, that doesn't mean that there won't be other outbreaks elsewhere. As the Premier said, we still have people that are traveling every day across our borders. So this will not end really until we have a vaccine. Thank you, Mr. Boisvert.
Telegraph Journal.
Hi there. Given the public health guidance to those in the Campbellton region on not traveling out of the zone for the time being, and that the legislature is set to resume on Tuesday, will the Liberal MLAs of Zone 5 be permitted to attend that sitting? And if so, will any added precautions be taken?
Hi, Savannah. So when public health recommended that people not travel in or out of the area, we really meant unnecessary travel. So necessary travel would include work. So I would be entirely comfortable with people traveling in and out for necessary reasons as for work, and so the MLAs would be traveling for work purposes. And everybody in that area and everybody around the province is symptom watching all the time. That is our advice, no matter where you are in the province. In particular, though, that region, we are telling everybody to symptom watch. But again, as I keep saying, our borders are not completely closed. We have border measures in place, but there are still risks with people coming across the border. So everybody in the province needs to continue to monitor for symptoms throughout this entire pandemic.
Thank you, Ms. Odd. Thank you, Dr. Russell. Margot Castada-Akobari, Radio-Canada.
My question is for Dr. Russell, please. I was wondering if you could talk about visiting in special care homes. They will be allowed starting tomorrow, and what measures are in place to make sure that to see to the safety of these people? Well, for visitors in the special care homes, I mean the outside visit? Yes, well, so the announcement is that there will be visitation in special care homes. It'll be outside, and I believe up to 2 people, and it has to be with physical distancing. Is that what you wanted to know? Yes, and also, when will visitations be allowed inside? And in such a way that the residents will be protected. Well, for that type of decision, we would like to start with outside visits to see how they work before going toward indoor visiting. But there are discussions with social development concerning the measures that will be put in place to see to the safety of the people who go there. And these protocols will be in place. Thank you, Margot.
Bobby Jean McKinnon, CBC.
Thank you, Bruce. Dr. Russell, how many of the 300 people isolating are healthcare workers, and what does the contact tracing so far indicate for the risk of transmission both in and out of Zone 5?
Hi, Bobby Jean. I just heard part of your question. I think you wanted to know how many of the 300 were self-isolating were healthcare workers. That was part of your question?
That's right. And what does the contact tracing so far indicate in terms of the risk of transmission both in and out of Zone 5?
Regardless of where people are self-isolating, the risk of transmission obviously is low because they're in their household self-isolating. I can't remember the exact number of healthcare workers that were self-isolating. I think in the original few days, I think there were probably at least maybe 13, but I don't have the exact number, but I can get it for you. And so that was the number of healthcare workers that were self-isolating. And in terms of most of the 300 are self-isolating in Zone 5, there were a few in Quebec, and there were a few outside of Zone 5, but I think there was only a handful outside of Zone 5, and like perhaps 5 in total that are outside of Zone 5.
Thank you, Ms. McKinnon. Thank you, Doctor. Geneviève Normand, Radio-Canada.
Yes, thanks, Bruce. It is for Premier Higgs. I'd like to get back to Vicky's question regarding Campobello Island, because Premier, you said that you've had discussions with the federal government, with the state of Maine to keep the border open for the residents. But the reality is this 6-year-old child is stuck on the mainland, and her parents are being told that they can't go pick her up. And residents have said that interpretation of the policy at the border widely depends from an officer to an officer. They say that they can't get a straight answer from authorities. So, what insurance can you provide to the 900 New Brunswickers who live on the island about their ability to travel back and forth on the mainland?
Well, in this particular case, I would say send that information to me and you'll get a straight answer because I'll find out what the situation is and we'll deal with it. So that's all I need from this, and maybe our communications can connect with you after this session.
If I may,
may, Premier, jump in. I think that your chief of staff and I think yourself too has received an email about that on Tuesday.
Well, if so, I haven't seen it. So if we have it, then I'll look for it when I go back, and we will deal with it promptly. So that situation will be understood and dealt with. My answer remains the same as far as our agreement to move back and forth between the island. So I'm surprised to hear of a situation that doesn't allow that, for people to come straight through Maine into New Brunswick and vice versa, because that's the kind of the arrangement we have. So I'm interested to learn of exceptions, and I will deal with this one.
Thank you.
Thank you, Premier. Merci, Madame Normand. Bobby Jean, the number 6. Do you want to go back or leave it? 6 healthcare workers.
Is Bobby Jean still on the line? Because if she is, the number of healthcare workers that are self-isolating currently are 6.
Thank you, Doctor. Cela conclut la séance d'aujourd'hui. Merci beaucoup. That concludes today's update. Thank you very much.